Hello there, and thank you for tuning in. My name is John Commander. I am the EMS Training Officer for the San Bernardino County Fire Department in Special Operations. Today we're going to present to you what the emergency equipment that the firefighters with our department utilize on a routine basis. As you can tell in front of you, we have quite an array of equipment that we'll be talking about today. So today we're going to talk a little bit of what we call basic life support, or BLS. So what we're going to do is show you some of the BLS equipment that we are going to be utilizing out in the field. One of the basic tools that you'll see here is what we call a pulse ox. This is a fingertip one, but we also have on our cardiac monitor attachment as well. So we may use one or two. And the whole purpose of this is to find out what the individual's O2 saturation is at the time. Now what that means to you is basically how is the body taking as far as the oxygen in at the cellular level. So what we're trying to do is see what the O2 saturation level is, and hopefully it's above what we call 94%. If you're below that, then we're going to give you supplemental O2 using an O2 tank like this, and maybe one of two devices, such as a nasal cannula, which goes in your nose, and then or a non-rebreather mask, which delivers higher flow oxygen. Once again, it's based on your condition and also what the pulse ox reading at the time when we apply this. So this will provide some supplemental oxygen to the individual and maintain their saturation levels. If the individual is having some problems maintaining their airway, or they're unconscious and are breathing very slowly or erratic, then we have some airway adjuncts. And we have two of them. These are what we refer to as OPAs, or oropharyngeal airways, or NPAs, known as nasopharyngeal airways. The difference is one goes in the nose, and that's the ones in the front of you, and the ones that go in the mouth are these right here. So as professional rescuers, we have options to use as far as tools. So based on the condition and the situation, we may use one or the other. So the first thing we're going to use is what we call the NPAs, as we talked about. Once again, the trained professional will use this on a person who has failing respirations or can't maintain their own airway. So they'll select the appropriate size. They'll also be wearing what we call PPE, so such as what I'm having right now, gloves, some form of eyewear, and in some circumstances we may also wear a mask over our face, because once again, once we put these devices in, there's a possibility that something may happen and they may spew things at us. So we have to wear our PPE as far as that's concerned. So the other thing we're going to do is we're going to measure the device. It goes from the tip of the nose to the angle of the jaw. So length is one, okay? The other is looking at the nostril, which was the bigger of the two. Or in some cases, we also look at the person's pinky finger. And based on their pinky finger, it's the same size, then that's the size we use. Okay, and what we do is we lubricate this, because we don't want to put this in your nose very dry, because it'll cause some irritation. So we want to lube this up fairly decently. And once it's lubed up properly, we'll put it in the nostril, the largest one, and when we do, we'll put what we call the bevel into the septum. That's what you call your nose right there. And basically we start to insert this, and we gently twist it a little bit, because remember, your nose is not straight, okay? And we gently turn it until eventually it is seated. So now this allows air to go through this device and into the oral cavity and directly into the lungs. So again, the person can maintain their own airway, or we may assist their airway by using this device and a BVM, or bag valve mask. So example, the person is stopped breathing or is failing respirations, then gently tilt their head back and do what we call a CE clamp. And that's putting our two fingers on here and our three fingers on the edge, and we slowly ventilate them. So this is what we call a nasopharyngeal airway. Now I'm going to demonstrate for you the oropharyngeal airway, or OPA. Once again, this is a device that is used from the person who has no gag reflex and is not breathing or is in cardiac arrest. Once again, the trained professional will measure from the mid-lips to the corner of the jaw here, and then we'll insert it in one of two ways. The typical way is opening the mouth, placing it upside down, and then twisting it so it seats firmly against the teeth. Another technique we may also utilize is from the side. Same principle, but it's halfway. Once again, it acts as what we call a bite block, so if they start to seize or they bite down, it will provide an airway. Once again, we'll use the bag valve mask, the BVM, we'll tilt their head if all possible, hook this up to oxygen, and we'll assist their ventilation. Again, we'll make sure that the chest goes up and down. We feel compliance. So example, as I squeeze the bag, you notice the chest goes up, and as I release, the bag fills up. I also make sure that there's no leakage around the mask as well. Again, this is another airway adjunct at the basic life support that we utilize to maintain their airway. Okay. So there you have it, ladies and gentlemen. My name again is John Commander. I'm with the San Diego County Fire Department, and I'm the EMS Training Officer.